Hello and welcome to my channel. This is the video I promised on contraceptive options. Now, when I looked into these, it was because I wanted to make the right decision for me and my family, knowing that I do not want another child within the next 4 to 5 years, but that I'd also really still want to have another child if possible in future. Of course, my husband says one and done, but I'm really hoping that I'll use these 4 to 5 years to change his mind. Perhaps we'll be in a better financial situation or something. I'm giving us time to grow as a family. But that's what's important for you as well, to really decide where your family's at, what you are wanting. This video could also be rather helpful for other women that are wanting to know what the options are, even if they are not moms. So the first contraceptive option I'm going to discuss is the most common. Lots of people take it, everyone knows about it. It is the pill is a very common option, but moms need to know what they want out of it. If you are a breastfeeding mom, then you have to make sure that you are not on the combination pill. There are two different options. There's the mini pill and there's the more common combination pill. Now, the combination pill contains both progestin and estrogen, and the mini pill only contains progestin. Why it's important to know that is that when it comes to the combination pill, if you take that and you are breastfeeding, it will probably lower your breast milk supply and it will shorten your breastfeeding term. So you will not be able to breastfeed very efficiently on the combination pill. If you are a breastfeeding mom and you would like to still breastfeed going forward, then you need to talk to your medical advisor and make sure that they understand that you want to use a pill that will not be affecting your breast milk supply. The injection. This one is also a hormonal option. Generally, they contain progestin, so it should technically be safe for breastfeeding. What you have to know is that you have to go back to your healthcare provider every 3 months around the same day to get your injection to make sure that you are safe from any pregnancy risk. It's important to know that it takes up to 10 months for your regular fertility cycle to come back to normal. So it could take even longer for you to get pregnant again if you want to have another child after being on the injection for a while. The implant is another hormonal device, and at the same time it's what they call an LARC. That means it's a long-acting but reversible contraceptive option. So these ones, generally it's a small rod that they insert through a small cut in your upper arm, and this one can actually last up to 4 years. Of course, if you want to fall pregnant before then maybe they'll take it out. It would also, because it's hormonal, mean that you have to wait a bit longer before you fall pregnant again, because of course, like the other two options that I just mentioned, your body has to get back into its normal fertility cycle. I know generally if you want to have other children, the doctors tend, or if you haven't had a child yet at all, doctors tend to shy away from this one just because of its hormonal impact on your body. IUD stands for intrauterine device. Now this is a device, it's a T-shaped device that the doctor inserts into your womb. This is also a long-acting reversible contraceptive, and it's important to know that again there are two options. The first option is a hormonal option. This one lasts up to 5 years, and of course then they'd have to reinsert a new one if you are not having a child or if you are still fertile. Then the second option is the copper IUD. Now this one is non-hormonal and it lasts up to 10 years. So this is a really awesome option. Well, for me, I found it awesome and I chose this one. But of course, it really depends on you and your family and what works for you. It is a bit more pricey to purchase one and get it installed, and you do have to still get it checked every year to make sure that it is still working and in the correct position in your womb. My doctor told me that when you use the non-hormonal one, that's the copper one, then once they take that out, you're back to normal fertility straight away. Whereas if you're using the hormonal version, then again, just like the other hormonal options, your body needs to get used to its normal rhythm again and kick out all the hormones. For me personally, I decided on the non-hormonal also because I tend to feel very sick when I take anything hormonal. But of course, a lot of my friends do the hormonal options and have no problems at all. And it works for them, and it's worked for them for many years. So it really depends on you and your body and how you react to different things. With the barrier methods, you've got a few different non-hormonal options that you can use. With these, they are of course once-off options. They are things like your condoms, your cervical cap or diaphragm, you've got your spermicides, all those kind of things that just block temporarily conception from happening. Now with these, you can also use them as extra protection with the previous ones that I've mentioned already, which just makes it extra safe. The Fertility Awareness method is reportedly the least effective of all, but at the same time it is the most natural. So a lot of people for cultural or religious reasons choose this option, and it actually works for a lot of people as well. How this works is that you have to pay close attention to your cycle. So that's your fertility cycle and all your body signals and all of that to avoid pregnancy. Here, however, if you have an irregular cycle, then it makes it really difficult to time, and it makes it really difficult to actually use this method efficiently. Sterilization is a permanent option. Now here, it's if you definitely do not want another child. It's where they actually do an operation to cut or block your fallopian tubes so that you will not be releasing eggs and you will not be fertile to be able to actually fall pregnant. This is one of the most effective, they say, because now of course you're closed for business. But here you may need to take a break from breastfeeding if you actually have this procedure done, because of course all the medication that would be in your system, and because they say you could actually have a bit of pain as well. As we already know, women do so much. So I really wish that there was more I could tell you in this particular option. Now men's contraceptive options, there are only two currently. There's of course the condoms, which is part of the barrier method, and there is a vasectomy. What happens in a vasectomy is that your partner will then get his tubes cut or tied. It could be reversible if they are tied, but if they are cut, generally not. So that is also in the same boat as your sterilization, where of course it is a more permanent option if you really don't want to have any more children. They are currently trying to establish a male pill. How this would work is that you'd have to trust your partner to take the pill every day, same time. But they have not fully finished developing this, and they say it could take up to 10 years for it to be ready to be out on the market. Fun fact, why it would have to take up to 10 years is that they have actually just established the safety of this pill. Just last year, 2019, they had done testing to say that it is safe for men to take it. But it takes 60 to 90 days to actually reduce sperm count enough for it to be making like a really good impact that it would help. And so they are still working on it, and it's going to be a very long time. So unfortunately, sorry. Thank you for watching this video. If you liked this video, please give it a thumbs up. If you'd like more content from me, please subscribe. And if you have any questions or comments, please do leave them in the comment box below. Sorry for any interruptions in the video. Light was giving me a bit of a problem and my baby woke up somewhere in between. But I hope you will see me soon.